Hello divers, this is Dr. Kang, the scuba diving story, and today's subject I picked the equalization. Last time I talked about eustachian tube, which is the root for equalization of your middle ear. I run a website called Diving Medicine Q&A on a website called diveweb.co.kr. You can actually search very many topics in there, and it's also you can translate using Google. Now if you searched equalization, of all 1,500 questions, equalization was like 162. A lot of people have problem with equalization, and to talk about equalization, here's some brief overview. It's where do we equalize, why there are a pressure difference, why must we equalize, how to equalize, when to equalize, and some easier way to equalize. Also want to talk about some reverse block and ascent and external ear canal squeeze. If you don't take care of your external ear canal well enough, you also have this problem. And inner ear barotrauma should also be included. So the first should be where to equalize. Okay, we equalize middle ear surely. Sinuses, paranasal sinuses. This we'll cover later with different video clips. And masks. About the mask, it's not so much to talk about. Just blow into your mask, then it's done. But the middle ear is a different story. So why there are pressure difference? It's Boyle's law. You go deeper, you have a higher ambient pressure than the airs inside the airspace go through volume and density changes. So when you go down, the ambient pressure goes up and the air volume reduces, and that will squeeze the blood vessels and mucous membranes inside the airspace. So if we don't equalize, we experience a squeeze, which is pain. And when it is not taken care appropriately, you have actual damages. Sometimes you have mucous membrane injuries, and then even skin. Bleeding happens in middle ear cavity, sinus, sometimes the subcutaneous tissue of your facial skin. Even conjunctival hemorrhage is possible with mask squeeze. So how do we equalize? There are many ways or techniques, maneuver written in the book, and some of these are voluntary. Some of these includes voluntary opening of the ET, but not this one. Valsalva is a forceful addition of air into your middle ear. So it is most common used because it is easy, especially in scuba diving. It's maybe 95% of equalization is done using this Valsalva method. How we do it? Divers all know it. We just pinch your nose and blow through your nose. Then the lungs, air inside the lung will find its way into the middle ear. But still, this one does not voluntarily open the ET. So there's some concern with the Valsalva. Since it is not the voluntary opening, once it is blocked, it is even harder to open because of the pressure change. pressure difference. So to do this, we better do on the right timing. Sometimes it is too easy to blow too hard to give damage to other tissue. So actually you have a lot of air in your lung and you can easily blow too hard. Then there is some other problem with it. Too forceful a blowing can raise intracranial pressure, which is transmitted to the inner ear, and then round window can rupture out, which means you lose some of the inner ear fluid, which means you lose your hearing, and we have sudden deafness or sudden hearing loss. So Valsalva should never done too hard. So how we take care of it? You should first blow on the surface and then descend, which means you somehow make a positive pressure inside your eardrum, middle ear, and then you go down a little bit. And before you feel the squeeze, discomfort, the pain, you blow again. This will help preventing the Valsalva maneuvers concern. We can voluntarily open our ET. This is because of ET structure. When you swallow, ET opens. When you yawn, it opens. When you wiggle your jaw, it also opens and closes. So these should be used more. For example, it's Toynbee Maneuver, Toynbee Technique, whatever. Pinch your nose and simply swallow. Then you can hear the click sound, and which means your ET was open. Then you blow the same time. This is probably easiest, and it's not as forceful as a Valsalva, but can still be an effective because muscle of orifice of ET moves. Freedivers know how to use this. Frenzel, pretty much the same. You pinch your nose and you block the back of your throat, like when you are lifting up a dumbbell, you know. And then you make a sound like this pushes the air through the orifice into the middle ear. This you need a little practice, but still this is a very effective way. Try again. You block the back of your throat, and then just like you're lifting up the dumbbell, then it opens ET. Lawry Technique. This is probably this is one of the best way. It's Valsalva and Toynbee done together. You just pinch your nose, do the Valsalva and swallow at the same time. Edmonds Technique. This is you force your soft palate and the throat, push the jaw forward and down. Forward and down of the movement kind of push air up and into the ET. And then there's almost simultaneously you can do this Valsalva. This helps also. To be able to do or use all these techniques, we need to practice. So you can practice in front of your mirror. Then you see what you look like. But still, these are very effective way of practicing equalization technique. Also, if you are a scuba diver, put your regulator second stage in the mouth and practice. Otherwise, free divers don't have to do that, but the scuba divers need to practice with second stage mouthpiece in your mouth. Duck, which means me, what I do most of the time, I do the Valsalva, and if there is any problem, I just wiggle the nose. Oh, sorry, wiggle the jaw. I rarely have a problem. Okay, when do we equalize? The key is you have to equalize early and frequently. So until the depth of 33 feet, which is 10 meters, you need to blow 15 times to make it safe. This is actually very many times, but it's almost like just keep on blowing as you go down and down. If you need to slow down the speed of descending, you should take horizontal position. Then you go slower and less change of pressure, and you have better timing for equalization. After 10 meters, 15, 20, as you keep going deeper and deeper, the frequency of equalization is much reduced. So at the depth of like 30 meters, I sometimes move like 5 meters without doing it. It is possible, but it's also important that you have to do before you feel the squeeze or pain. So the easier way to equalize, you check your ET orifice functioning properly before you go down, which means you just swallow and you can hear the click sound. Try it. Actually, if you hear the click sound, that means your stacking tube opens correctly. Open and close gives you click sound. Now, before you start diving, like 1 or 2 hours before you practice, so you can keep the ET functioning okay before you start to dive. I think this is very important. So when I go diving, before I go for diving, I usually do lots of this. First, equalize at the surface, meaning positive pressurize your middle ear before you go down, and also equalize or positive pressurize before you feel the squeeze. There are some other things as well. So as soon as you're submerged, as soon as you're underwater, take horizontal position. Don't go down all the way in the upright position. You take horizontal. It means many other things as well, not just for the equalization, but you can give equal pressure to your body, but that's above the scope of this video. So if you go down in horizontal, maybe only 50% of the power that you use during upright position, you can open the ET. And also when you lift up your head like this, especially like divers do head, body, this. It's a trim position, and with your head up, it kind of opens, partially at least, open the ET. If you are a novice diver, if you are just beginning to dive, instructors also, you should give your student some control line, decent line. It's also in the standard of teaching that for the first 1-2 dive, you absolutely need to use the descent line. If you use it, you can control the speed of descent and also the timing of equalization. Always equalize before you feel the discomfort. stop descending. Stop descending if you feel pain. So go up a little bit until you feel the pain is gone, and then you blow, and then you start descending again. If you keep going down with your pain, with discomfort, you don't like to do it. Make sure that squeeze doesn't destroy your middle ear and inner ear as well. So some people use some people use air in your nose pocket of a mask to clear the fogging mask. So there's always some water in here, and this water can go into your nose and irritate the mucous membrane of the nose, producing more mucus, more discharge, and which can somehow block the ET, just like smoking and alcohol does. Don't smoke. Divers, please don't smoke. Let me take a brief look at the reverse block on Ascent. The reason I bring it up, this is a little different concept, but as you ascend, the expanding air cannot find its way out because ET is blocked somehow. This is really painful. So why do we get reverse block on Ascent? Of course, the symptom is pain, sometimes vertigo, but if you use the technique that you use as you go down, I mean equalization techniques sometimes can help relieve the reverse block, especially some of the voluntary opening of the ET techniques like swallowing, wiggling, yawning, but you don't want to do it with your mouthpiece in your mouth. But anyway, these can sometimes open up the ET and let the expanding air out. If you feel pain in one ear, put it downward. This can relieve the problem a little bit. Make slow ascent as long as your air permit. You cannot make fast ascent when you have reverse block because it is too painful. Just try to slow down your ascent as long as you have air, and you do everything that you can do so that you can come out of water. You don't want to stay down and see what happens. Usually last 10 meters, 33 feet is most difficult and or painful. We also have inner ear barotrauma. One thing I like to stress on this is when you do too forceful a Valsalva method, your intracranial pressure goes up, and that is transmitted to the inner ear fluid. So when inner ear fluid gets high pressure, it finds its way out through most of the time round the window. Over window is where one of the three ossicles, small bones, which has a foot plate, is placed. So it is kind of tighter, while round window is just the membrane. So when inner ear pressure goes up, round window is usually ruptured, which gives you immediate loss of hearing. Sometimes, depending on the amount of inner ear fluid loss, sometimes it can be partial loss, sometimes it can be total loss. That total loss can return, but you may lose your hearing permanently, and you don't want to do that. So when you cannot equalize easily, don't ever try to go down with pain, because this is a very serious problem we have. once you lose hearing in one ear, I completely ban him from diving, because if the same thing happens on the other side, we don't want to, see that. External ear can also go through some barotrauma, like a too tight hood. If you have an impacted earwax, if you use earplug that you use during swimming, then somehow the air goes into the external ear canal and trapped between tympanic membrane and the plug. Then that itself, as we go down, can squeeze and can damage membrane and the skin as well. Sometimes we have bones that grows in the external auditory canal, especially when we go into the cold water, and cold water keep on irritating that bone tumor. It grows up. So very often you need some surgical removal of the tumor, which usually take care of the situation. You cannot equalize the air trapped in your external ear canal, so you have to prevent it. This probably is a very important issue for all of us. Can I dive after or with middle ear barotrauma? Let's say we take a one whole week of a liverboat trip, and we get hurt on the first day, first dive. You have ear fullness, pain, sometimes bleeding. You have to stop diving immediately, because more serious, more severe inner ear trauma can come with infection or with some barotrauma. So you have a very high risk of secondary infection when you have your tympanic membrane ruptured. Abort and stop diving until the symptoms or disease are completely gone or treated, and get advice from your ear, nose, throat doctor. You can dive forever if you give up on this dive. Please don't dive with your traumatized tympanic membrane and eardrum. So today I talked about equalization, talked a lot about where to dive, why the pressure difference, the reason we have to equalize, how to equalize, when to equalize. So talked also about reverse block external ear canal squeeze, inner ear barotrauma. This is one of the most frequently asked question on I cannot equalize, what should I do? I hope this video can be of a little bit of help to all of you. Thank you very much.